Well, for more than 20 years, Douthat Insurance has been helping people with their insurance needs. If you're a senior, they can help with Medicare, life insurance, long-term care, and dental, helping you not only with the insurance, but navigating that care. Margaret Douthat joins us now with more on Medicare and some of the common questions that they get. Margaret, thanks so much for joining us.
Oh, thank you for having us.
So talking
having a great day.
Yeah, you too. Talking a little bit about Medicare, and I know, first of all, let's talk a little bit about the timetable when it comes to Medicare.
Right. So many people don't really understand when they can or cannot change their policies. If they're just enrolling in Medicare, that's typically when someone's turning 65, or possibly if they have been qualified for disability. And generally, they're on disability for about 24 months before they become Medicare eligible. Those individuals have a time period where they can enroll right before their Medicare begins or a few months after. So that's very important that they utilize that time frame to pick and choose the policies that are going to best suit them. There are also individuals that have the ability to enroll, change policies during the Medicare annual election period, and that's October the 15th through December the 7th. And so sometimes people will get those time frames confused. There's another whole segment out there that they're retiring, and or in this case, because we've been dealing so much with employers and having to navigate loss of reduction, some people have declined their Medicare because they've been working and they've had employer coverage, and now they're needing to pick that up, either because they're choosing to go ahead and retire earlier than they first anticipated, or because the employer just has to do a reduction in staff, and so that's creating some. And we are here to help people kind of navigate what's out there for them and when they can make those choices and how to make those choices and help them get set up in a policy.
Yeah, it sounds like there's a lot of different parameters, so a lot of different things coming into play here.
Yes, very much so. And it can be so confusing because there is a lot of media marketing, about the annual election period, but there's several individuals that can still enroll now. There's also another whole segment of population that can change their policies throughout the year. So those individuals, if they're receiving additional help, so it's called extra help through prescription drug plan. So if they're receiving that extra help, or if they're actually on Medicaid or TennCare and have Medicare, they can also change their policies during certain times of the year. They don't have to wait until that annual election period. So certainly we'd be happy to help someone if they're not sure if they do qualify, or if they would like to see if they can qualify for that prescription assistance. We can walk them through that and help navigate that, and help them if they've never chosen a plan. That gives them the opportunity to do that, or if they have a policy right now that's not working well for them. Some of these policies out there for individuals that have Medicare and Medicaid receive several extra benefits above and beyond the normal and no cost. So they can receive some help for dental care and vision care and hearing, and even sometimes transportation.
And Margaret, with all of this wiggle room, and it sounds like there's a lot of really good things, I would imagine that relationship with your client is so important, because you really walk people through the services that they can qualify for.
Absolutely. We want the very best for our clients, regardless of, whether they've been with us for several years or just coming on board. We want to make sure that you're enrolled in the best policy. We do not work for an insurance company. We work for our clients. And so that's who we have the interest in the best desire for, as far as your coverage and just understanding, so you can enroll in a policy and feel like you have a good grip on it, and 6 months later you've forgotten a lot of the details. And that's why we're here. We just want to make sure that you know and utilize every opportunity that you have to be covered the very best for you personally.
Well, you can definitely tell your heart and soul into your clients, and that can make all the difference. Margaret, thank you so much for taking the time to talk with us today.
Absolutely. Thank you.
We'll give everybody the information if you would like to get in touch with them. They represent several counties throughout our area. It's Douthat Insurance, and here is their information. You can call their office or you can stop by to meet Margaret and the team.